Chapter 33, Health Promotion and Care of the Older Adult. Health and Wellness in the Aging Adult. Older adulthood defined. Older adulthood begins at about age 65 and continues until death, a possible span of 40 years or more. Older adulthood has been divided into 4 subgroups: young old, 65 to 74 years, middle old, 75 to 84 years, old, 85 to 99 years, and elite old, 100 years and older. Other terms that may be used to refer to the aging population include frail elderly, which refers to those individuals older than 75 years of age with health concerns. Centenarians are those who are older than 100 years of age. Although older adult is tied to chronological age of an individual expressed as time elapsed since birth, chronologic age may not be an accurate predictor of health or behavior. Some individuals may be considered old in their 50s because of their appearance, behaviors, or health status. Today, more people are living longer active lives. Most consider maintaining activities and participating in healthy living behaviors as deflectors of typical age perils. Demographics. In the United States in 2015, 47.9 million people were 65 years of age and older, more than 14.9% of the population. In the past 2 decades, the population of older adults ages 65 and older has grown twice as quickly as the rest of the population, and this increase is expected to continue. The U.S. Census Bureau estimates that by the year 2050, there will be 83.7 million people over the age of 65 living in the United States, more than double the number today, making them about 23.55% of the population. Approximately 54% of these will be women and 46% men, estimating that most older adults will still be non-Hispanic white, 56%. Hispanic older adults will make up 21.2% of the population. Non-Hispanic African Americans will make up 12.5%, with other races making up the final 10.3%. In 2015, the life expectancy in the United States was 79.3 years. This placed the United States at a ranking of 30th overall in the world. In the past 50 years, life expectancy for Americans has increased by almost 10 years. Healthcare for older people has become more complex for several reasons. Scientific advances in treating life-threatening conditions of the past, substantially increased life expectancy, greater focus on ethical and legal issues related to life, disease, research, and dying. Older adults are a diverse group in terms of age, life experiences, the aging process, health habits, attitudes, and response to illness. To best meet the challenge of delivering age-appropriate care, know the differences between normal aging versus illness or disease-related changes, and be able to assess effectively older adults with delirium, dementia, and depression. To promote the patient's return to health and increase the speed of recovery, be familiar with rehabilitation care services. Older adults often are concerned about losses of function, and they need their care providers to provide respectful care that allow them to maintain their dignity. Wellness, health promotion, and disease prevention. Wellness is more than just the absence of disease. Wellness is the individual operating at the optimal level of function, and even during chronic illness and dying, some level of well-being is attainable. Wellness involves a balance among the individual's emotional, spiritual, social, cultural, and physical states. Box 33.1 lists the traits of a healthy person. The role of the nurse is to assist individuals to adapt to their life situation to achieve this balance. Health promotion takes a positive approach to health and emphasizes the strengths, resources, and abilities of an individual. Primary prevention stresses exercise to prevent cardiovascular disease, falls, and depression. Older people who quit smoking can reduce their risk of heart disease and improve lung function and circulation. A well-balanced diet without excessive sugar, fat, or alcohol is another important aspect of primary prevention. Primary prevention also includes recommended vaccinations. Immunizations recommended for older adults include an annual influenza vaccine, a tetanus, diphtheria, TD booster every 10 years, a zoster vaccine for those over the age of 60, and pneumococcal vaccines, PCV 13 and PPSV 23, after 65. Secondary prevention in older adults focus on early detection and treatment of disease, including screening for heart disease and hypertension, cancer, infectious diseases, polypharmacy, misuse of multiple medications, nutrition, oral health, osteoporosis, falls, and social isolation. Healthy aging. Healthy People 2020 set forth the goal of the U.S. Department of Health and Human Services to prevent health risks, unnecessary disease, disability, and death. These recommendations are in the process of being updated in Healthy People 2030. A summary of the current 2020 goals as they relate to older adults appears in box 33.2. The focus of these goals is on improving functional independence and the quality of life. A growing number of adults are living into their 90s and beyond. A significant number of this population maintain their health and remain active up until the time of their death. The age of 65 is no longer considered old. This reality changes the circumstances of life planning, social services, employment, and social policy and the focus of healthcare. Keeping this population healthy, active, and moving necessitates a high standard of assessment and health promotion. Born between 1946 and 1964, more than 70 million people are baby boomers. They make up approximately 29% of the nation's population. The older baby boomers are entering and approaching young adulthood. More than 1.5 million of them will live to 100 years of age. This group is extremely diverse and better educated, more mobile, and more aware of how to achieve and maintain good health than any previous generation. They recognize the importance of nutrition, exercise, and a healthy environment. Many are concerned about the future in terms of available health care. As more people take charge of their own health, many have found limitations in conventional medical approaches and have begun using alternative health strategies such as meditation, visualization, massage magnets, aromas, and acupressure or acupuncture. Some of these therapies are effective, some are not. A method effective for one individual may not be for another. The patient must be cautioned to investigate the qualifications of the provider thoroughly, research the method under consideration, and use only one therapy at a time to allow sufficient time to identify reactions. A holistic definition of health does not limit health to its physical and mental aspects, but rather views health as a state of being and attitude. It seems only natural to encourage people to make decisions that affect their own lives, but healthcare providers frequently fail to do so. Given sufficient information, most individuals make appropriate decisions. Knowing the value others assign to us and being treated with respect build and sustain self-esteem. Addressing an older adult as gramps or grandma, honey, or any other similar term of familiarity is inappropriate unless the person is the caregiver's grandparent. Older adults should be called by name or what they choose to be called. This indicates respect. Use of the person's first name is also inappropriate unless the person so specifies. Forcing changes that exceed the individual's ability to cope sometimes results in mental deterioration, physical illness, and even death. The role of the nurse includes affirmation, enhancement, and support of each person's movement through the aging process and encouragement of health and wellness. Myths and realities. Some of the myths and stereotypes of aging and older adults are prescribed in box 33.3. Most myths are generalizations that focus on the negative aspects of aging. In many cases, research has proved such myths to be inaccurate. Theories of aging. Our current knowledge about aging and the aging process is limited. In an attempt to explain aging and the individual's response to aging, experts have proposed a number of theories. box 33.4. Biologic theories attempt to explain why the body changes. Psychosocial theories try to give reasons for the responses and interactions older adults have with society during late adulthood. See chapter 24. Ageism. Ageism is a term that describes prejudice against older adults. It reflects a negative response by younger people, a personal dread of growing old or becoming disabled, and a fear of powerlessness, uselessness, and death. Ageism systemically stereotypes and discriminates against people because they are old, just as racism and sexism stereotypes and discriminates against people on the basis of skin color and sex. To enhance the quality of life for older adults, support the patient's hope, pride, confidence, security, and integrity. All members of the healthcare team should work toward eliminating negative attitudes and discriminatory practices. Legislation that affects older adults. The first major legislation that attempted to provide financial security for older adults was the Social Security Act of 1935. At the time this law was passed, few people lived long enough to collect significant benefits. Over time, increasing numbers of politically active older adults sought and achieved legislation designed to benefit themselves. In 1965, the Older Americans Act, the OOA, was established. It aimed to preserve the rights and dignity of the nation's older citizens. This act was updated and amended in 2006. The amendments retain provisions for low-income minorities and add emphasis on older individuals who reside in rural areas. The increasing number of older adults also raises the issue of the needs of their caregivers. The National Family Caregiver Support Program provides a means of addressing the growing needs of caregivers. In 2000, an additional program was added to support caregivers of American Indian elders. The Patient Protection and Affordable Care Act was signed into law in 2010. The result of this legislation are still developing, but the law encourages payment for preventative services to Medicare recipients and provides a drug discount for eligible seniors in the Doughnut Hole. The Doughnut Hole is a coverage gap that exists in most Medicare D-prescription plans. The plans pay a percentage of the cost of medications up to a certain amount. When that amount is reached, Medicare recipients must pay 100% of the cost of prescriptions up to a yearly maximum out-of-pocket limit. After the maximum limit is met, the coverage gap ends and the prescription plan pays a percentage of the cost of covered drugs again. Proponents of the ACA state that the law provides new protections for seniors and cuts down on waste, fraud, and abuse. Since its inception, the ACA has been met with concern over costs to those it was developed to cover and by insurers. The nation's legislators continue to propose changes in the scope, cost, and implementation of the act.